today we'll be addressing the opioid epidemic, right? Do you know what opioids are? What the opioid epidemic in the United States is? No? Okay. So basically the objective is, just to discuss the current opioid epidemic in the United States. So what is an opioid, right? That's the question for today right now. What is an opioid? So an opioid is including both prescription pain medication and illicit drugs. Both can be physical and psychological dependence. Then when we think about examples of different drugs, right, different prescription pain medications, we think about natural opioids, which is your morphine and your codeine. Then you have semi-synthetic opioids, which is oxycodone. Then you have some stuff like hydrocodone, the common drugs we hear like rappers and stuff talk about. Then we get in synthetic opioids, which is fentanyl and methadone. Then our illicit drugs is heroin. Rallo be like, I got that dog food. That's what he be talking about in his songs. He be talking about heroin. So then we get in some facts, right? So drug overdose death has become the leading cause of injury death in the United States, right? And it's higher than actual car accidents and stuff like that. Which is crazy. So 55,403 lethal drug overdoses reported in 2015, of which 20,101 of them 20,101 of them were related to overdose due to prescription pain medication, and 12,990 were released to heroin overdose. See, that's crazy. A lot of people are dying from prescription drugs, and they dying from the illicit drug. So in 2015, 3.8 million, which was 1% of people 12 years or older, was misusing pain medication. We gotta blame this on our rappers and stuff, talking about drinking lean and stuff like that. So 4 in 5 new heroin users started by abusing prescription pain medication. That's crazy. So this state right here, we go focus on the state of New Jersey with this map. So the darker the map means, like the darker you see, the darker part, it just basically just telling the number of different deaths in this region right here. So 128,000 people were addicted to opioids or heroin in 2015. 32,529 substance abuse treatments, admissions related to opioids in 2015. So cases related to heroin abuse was about 27,000. Then you have 4,000, really 5,000 related to the abuse of other opioids, which was ecstasy, mumau, and these counties with the highest number of reported cases. So that was just the different counties, right? So drug abuse. When we think about drug abuse, we think about marijuana, alcohol, opioids, cocaine, steroids, tobacco, nicotine. So for the first specific drug associated with initiation of illicit drugs, this was a little survey in 2013. So marijuana, right? You see how marijuana was, boom, that's 70%. Then you had pain relievers was 12%. Then there was some like little other stuff in here, which you can see. And cocaine was less than 1%. And it was the illicit drugs. So the past month with illicit drugs use by the year of 2013, 2012 and 2013, you had the ages around 21 to 25 who had the highest age of misusing drugs, illicit drugs and things like that. So that's the age group that we was focused on, was for the kids from basically 18 to 25, but you could really see in the 25 to 20 to 25 range where it's way more using of the illicit drugs and just abusing the drug. So prescription drug abuse, right? The current trend. Increased number of pain medication being prescribed. So a lot of doctors are prescribing people these pain medications. Greater social acceptance of using medication for different purposes. So these risks includes misuse, abuse, addiction, and overdose. 1 in every 4 chronic users of prescription opioids for non-cancer pain in primary care settings are affected by addiction. Over 1,000 people are treated in the emergency department every day for misusing prescription opioids. Heroin abuse, right? Heroin is a semi-synthetic opioid with no accepted medical use in the U.S. Heroin is injected or snorted, which enters the body and brain very quickly to produce an extreme high that is highly addictive and dangerous. So here's just a map of, you see the sex, the males, the age, and again, that 18 to 25 range, the percentage is up. Then we have males. The percentage is up in the males and then females. And if you see again, the other, you have other, which is, and you say have other and non-white Hispanic, but the others have a more chance of addiction. Like it's higher with their race and ethnicity with addiction in that group. So then we just talked about the heroin. So heroin, how is it more addictive, right? So people who are addicted to alcohol is 2 times more likely to be addicted to heroin. Marijuana is 3 times likely to be addicted to heroin. Cocaine, if you're addicted to cocaine, you are 15 times more likely to be addicted to heroin. And people who is on opioids are 40 times more likely to be addicted to heroin. 40 times if you're on opioids. We'll see. The reason is because heroin and opioids are not too far from each other. So from prescription opioids to heroin, approximately 3 out of 4 new heroin users report having abused prescription opioids in the past. Easier to access heroin than prescription opioids, right? Heroin does not require a prescription, right? You can get it in the street price for heroin, may be more affordable than the prescription opioids, correct? The concerns with heroin, which is a higher risk of overdosing, is a concentration with harmful impurities, and transmission of diseases through injections of needle and sharing. So people, junkies sharing their needles and stuff like that. You might not just be a junkie or somebody addicted, you can possibly catch HIV or AIDS. So we just look at the acute versus the chronic consequences of opioid use, right? So the acute is drowsiness, sedation, decrease of breathing, withdrawals, blood-borne diseases through needle use, overdose. The chronic, right, is the tolerance, the physical and psychological. We think about the inability to maintain relationships with people. Then you also got to think about the inability to maintain performance at work. You on them pills and stuff, go to sleep at your desk. If you studying, because we was talking about the 18 to 25, so I'm thinking most of them kids are probably in school or higher education, so not focusing, not doing their work and stuff like that. Then we just recognize the opioid dependency, right? Just dependent. So it declined performance at work, what I was just speaking on. You have loss of interest in favorite activities, whatever your activities are. It changes eating or sleeping habits. It also increased aggression or irritability. Then you have sudden change in social network. Then you got constantly feeling tired and sleepy. So them are some of the things that recognize opioid dependence. Then we have another chart, right? And it's just telling us the death rates involving opioids by the type of opioid in the United States. And this was just from 2000 to 2015. And this was provided by the CDC Gov. So if you could see in this map, any other opioid is higher on this map than heroin, than natural and synthetic opioids, and other opioids. So the opioid alone is just higher in this map. And that just goes, you see how it increases from early 2000 to 2015. So the economic burden of opioid abuse is definitely a burden in our communities and things like that. So non-medical use of opioid pain relief costs insurance companies up to $72.5 billion annually in care costs. That's a lot of money. Social and economic consequences, right? So cost of prevention and treatment, you have increased incidences of opioid overdose deaths. You have safety risks to the public due to drug-affected driving. So people would be damn high as hell trying to get on the roads. Well, that leads to car accidents and things like that. If you high not being paid attention or you falling asleep at the wheel, that will lead to car accidents. Then you also have environmental contamination due to inappropriate disposals, illicit drugs, basically. So people with needles throwing their needles in the street. That ain't you definitely not supposed to throw no needle or nothing like that in no street. You're supposed to put it away. Then you have loss of productivity at work. And that's another one. So now we're going to talk about the physical dependence versus the addiction, right? So the physical dependence is basically the body is used to have a high level of opioid. So if your body is used to having a high level of opioid, it abrupt discontinuations, which will result, which you will have withdrawals and nausea, vomiting, and anxiety. So if you dependent on this drug, your body is going, and you trying to get off of it, your body is going, and you haven't been using it, your body gonna be nauseated. You gonna feel like you're vomiting. You gonna have anxiety. Then we talk about addiction, right? It's uncontrollable craving and compulsive use, inability to control drug use. There is no addiction without craving. So you'll crave for this stuff. That's any addiction, though. Addiction is a chronic, progressive brain disease due to an altered brain structure and function. So basically, when we talk about opioid is a chronic disease. Because if you think about chronic diseases, it's basically pain related. So when things are pain related, right? So this how it goes. You have your chronic disease, which is pain to pain, right? But then when you think about it, you have your opioid, and your opioid is basically there to help. The drug is there to help you with your pain. But most people are getting addicted to these opioids. That's why it's a chronic disease, because it's helping with the pain, but it's also affecting you in the long run because you're getting addicted to it. So you have treatment options. Last but not least, your treatment options, right? The best treatment option is prevention. Prevent it. So you can do counseling and behavioral therapies, which include individual and group counseling, inpatient and residential treatment. You have case management. You got recovery supports services, 12-step fellowships, peer supports, the medication assisted treatment. You got your different drugs, which is just your methadone and your naltrexone, things like that. And these are just some treatment options, and just some take-home points for you, right? So prescription opioid is just as dangerous as illicit drugs when not taken as directed. If you don't need the medicine, don't take it. You can get easily addicted to it. Quit. Just like if somebody's never sniffed crack or cocaine before, or never did heroin. As soon as you do it, you opened your body up to do this drug over and over. So another bullet is prescription opioid abuse is strongly linked to heroin abuse. Opioid addiction is a disease which requires treatment. You must get treated. You must get treated. Just like if you're on heroin, just like if you was on cocaine, you must get treated. Just like if you was alcoholic, you must get treated. The best treatment for opioid addiction is prevention, like I stated on the last slide. So we're done with this right now. As being a great audience and a great listener, do you have any questions? Or, well, the question I want to ask you, right? Have you ever dealt with anybody with a opioid or any type of drug abuse?
I've heard of it and people around, but nothing like personal.
Nothing personal. Okay. Another thing is, do you have any questions for me? Anything you learned or anything? Like, what do you think opioid is now? You remember when I first asked you, I said, what was opioid? You said you don't know. So now, going through this, what do you believe opioid is?
It's a drug addiction, but it's supposed to help, but it's really hurting people in the long run.
Okay.
Because they get addicted to it.